So hyaluronic acid, when it comes to aesthetic or skincare use, comes in all shapes and flavors, and that will dictate some of the effects that you may see and also the risk profile. Let's start with shape. So really it's more about length than the exact shape. Smaller hyaluronic acid molecules generally will grab onto fewer water molecules, so you're not going to have quite as much of a gel-like consistency. It's a little bit thinner, it's a little bit runnier, which is going to be fantastic if you're applying it as part of like a skincare routine and you're just looking for a moisturizer. When we move on to products that are injected, they come in what we call a mesogel. So the chain lengths are a little bit longer, it's a little bit stickier, it grabs more water molecules, and it becomes a thicker gel. And so you'll see these in sorts of products like, for instance, Look, or even in a Skin Vive by Allergan, where it's generally smaller, used primarily for hydration, not so much for volumization. Then you get into the really long chain hyaluronic acid molecules. They're going to grab onto many more water molecules. It'll be more gel-like, it'll be a little bit thicker, and you can even take it on to the next step by cross-linking them, whereas previously only had one long hyaluronic acid molecule. Now you have multiple long hyaluronic acid molecules together, and then you artificially link them together. This is what we call cross-linking, and is what you see in most hyaluronic acid dermal filler products. And because they're cross-linked, they're even more gel-like, they can be more firm, they're gonna hold on to more water molecules, and when you inject it, you really get a very noticeable volumizing effect. So whereas something was previously sunken, for instance, like the eyes or the temples or wherever it happens to be, it's now bloated up, it's more swollen in a very aesthetically pleasing way. So to really simplify it, when you see a product that has hyaluronic acid in it, really they're just using the property of the hyaluronic acid molecules, grabbing onto a bunch of other water molecules to get you kind of that more swollen, that more hydrated look. In the medical parlance or the cosmetic parlance, we call it a humectant. It's anything that holds on to water molecules. So when you see it, that's what it's there to do. When it comes to the risk of hyaluronic acid, know that if you're injecting it, there's always a risk of getting it into the blood vessel. What determines whether or not you have a catastrophic or non-catastrophic complication depends on whether or not that product is going to block a blood vessel and for how long it's going to block that blood vessel for. So thinner products, more runny products, more watery-like products are generally considered lower risk, whereas really thick, high viscosity, like hard gel-like products are going to represent a higher risk.